hope you're feeling pretty today. Some people like to get some work done. No judgment. Fuller lips, narrower noses, more prominent cheekbones. This is nothing new. But plastic surgeons say they're seeing more and more patients at younger and younger ages. The American Academy of Facial, Plastic, and Reconstructive Surgery says Gen Z is flocking to plastic surgeons at record numbers. 75% of surgeons reported a spike in demand from clients under age 30 in the past year. Yes, there's a less invasive work, Botox, fillers, chemical peels, microneedling, the most popular. Some are coming in for surgery, like facelifts, eye rejuvenation, nose jobs, those top the list. Let's bring in American Academy of Facial, Plastic, and Reconstructive Surgery President and Board Member Dr. Theda Kontis, live from Maryland. Okay, Dr. Kontis, cosmetic surgery, we know that people want to look younger and look better, but Gen Z is anywhere from about 11 to 26 years old. So are you seeing teenagers coming to plastic surgeons' offices? And what in the world are they getting done?
Well, that's a very good question. You know, for years, we've had teenagers come in for rhinoplasty. And that's sort of a common thing that young people ask for. But we are seeing now some young people coming in, even with their parents, for some injectables, mostly for the lips, actually. And for these young people, it's more of seeing a deformity in themselves. They see maybe their upper lip is a little bit too small, and they ask their parents if it's okay to get injections, and they bring them in sometimes.
It sounds to me like parents are more comfortable with it. And so it's kind of like, oh, mom and dad are doing it. Let me just get a little plump up on the lip. I mean, it's just become more casual for people who are over a certain age so that their kids are doing what kids do. As mom and dad does, you know, the fruit doesn't fall far from the tree, but the Brazilian butt lifts procedure for younger and younger people. The buccal, I hope I'm saying that right. Let me know if I'm not. Buccal fat removal to make your cheekbones appear more prominent. Is this all because
buccal fat is right in here?
Right here. Is this because they want to look like their favorite celebrities on TikTok?
Very commonly, yes. But it's really, in my opinion, it's a mistake. The buccal fat is right in here. And as we age, we lose that fat. So we get hollowed out. And, you know, we do all these fillers, right, like Restylane and Juvederm, to fill in the face where we've lost the volume. So taking that beautiful fat away is a mistake because it's going to look good now, but when they're older, it's going to look terrible.
I love how you said beautiful fat. I think we need to write a book, you and me, and it's going to be titled Beautiful Fat, because there are so many, I mean, you look at modeling today, and there's been this influx or this change to seeing women who are not just a size 0 and, you know, curvy and just embracing their body types, but still we're seeing this rage in plastic surgery. What would you tell a parent or a grandparent to tell their child who's saying, you know what, I really think I need to get my face done, and it's just too young?
Well, you know, there is something called body dysmorphic syndrome. And that's when a person perceives a defect in themselves that ruins their life. And it's probably some minor little defect. It may be something that even you and I can't see, but it's something that just devastates them. And you have to be so careful that that isn't the issue, because that's more of a mental health issue. So, you know, if a child is complaining about a deformity that they perceive, it's not a bad idea for the parents to bring them in to see a surgeon. And you know, an ethical surgeon is going to say, you know, leave it alone. That's normal. That looks fine. Or if they do perceive that it's something they can help them with, it's a wonderful thing for mental health. I'll tell you a personal story. I was 14 when I had my rhinoplasty done. I perceived my big Greek nose as a deformity, and all I did was focus on it. And once I had my rhinoplasty, I felt normal and I stopped looking at it. And the things we can do for a young person's self-esteem to fix that is wonderful.
It really is about what's inside. And that will never grow old. You just got to talk to them and let them know what it's inside that counts. Dr. Theda Kontis, thank you so much for being with us. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.